Go.
Okay. Hi, my name is Bianca and I'm going to be your nurse today. Can I verify your first and last name and date of birth? And do you have any allergies to any foods, medications, environmental factors, or latex or tape? Okay, since I already asked her name, can you tell me where you are right now? And can you tell me the time and who is the President of the United States right now? Okay, perfect. Do you have any pain? If this client has any pain, I would do an old card and ice. And how are you feeling? What is your mood today? Do you wake up feeling this way every day? Okay. And can you describe your stools for me? What color is it? What consistency is it? Okay, and how often do you have a bowel movement? Okay, and what color is your urine? And how often do you urinate in a day? Okay, do you have any burning, pain, frequency with urination? And does your urine have a foul odor? Okay, so that would be the end of my interview, and at this time I would have already taken vitals. Her temperature was 98.7, her heart rate was 69 beats per minute, respiratory rate 18 breaths per minute, and blood pressure 121/79. And we would have already done the Snellen test as well, which is the test to test her distant vision. She would have stood 20 feet away from the chart, and 20/20 is the ideal vision for that. And she would have read every line. Going down, if she got all the letters in the line, she would move one line down, and half the letters, another line down. But if it was less than half, you would go one up. Okay, so at this point, hand hygiene. Grab my pen light, and I'm going to test, I'm going to inspect her ears. So looking in her ear canal, it is pink, moderate cerumen, no drainage, no swelling. Other ears, same thing, no drainage, no swelling. Ear canal is pink with moderate cerumen. And then I'm going to test her pupils. So just going to look for direct response and consensual response. Direct response and a consensual response. Okay, now I'm going to test for nystagmus. My finger is 12 to 18 feet away, or inches away, and you're going to follow my finger with just your eyes. Don't move your head. Okay, now accommodation, so keep following my finger. Perfect. Now I'm going to go ahead and inspect her mouth, so open your mouth for me. Looking in her oral mucosa, it's pink and moist. Lift your tongue up. Her frenula is midline. Stick your tongue out. Tonsils are grade 2. Her teeth look white with no cavities. Now can you smile for me? Okay, puff your cheeks out. And I'm currently looking for symmetry. Can you stick your tongue out? Move it to the left. Now move it to the right. Perfect. Now I'm going to sit her at a 45-degree angle and look for JVD. So you're going to turn your head for me, and I'm just inspecting the SCM muscle for any jugular vein distension. Same thing on that side. Okay, perfect. Now I'm done with that, so I'm going to hand hygiene and palpate her lymph nodes. So right here, preauricular, moving back here, postauricular and going down, occipital, and then right at her jaw, retropharyngeal, moving forward, submandibular, and then submental. And you're going to turn your head for me again, going up the SCM muscle and down the cervical chain, doing that twice. Other side, SCM muscle, cervical chain. And then I'm going to hook my fingers and go palpate the supraclavicular, and lymph nodes are non-palpable, which is good. You're going to shrug your shoulders for me, and I'm looking for symmetry. I'm going to test for turgor right at the bottom of her clavicle, and that is elastic. Okay, so now I'm going to go to her arms, testing range of motion. You're going to put your arms out for me like this, bend out your elbows, and touch your hands to your shoulders. Okay, and then for shoulder range of motion, hands at your sides, up, and back down. Okay, and so now I'm going to palpate her arms. Can you tell me if you have any pain or tenderness? Okay, skin inspection. Her skin tone is tan with a pink tone. No scars, lesions, or bruising. And now I'm going to feel for warmth using the dorsal surface of my hand. And for edema, just all the way down. Okay. Now for cap refill, I'm going to press at the end of her nail bed, release, and that is less than 3 seconds. Other hand, less than 3 seconds. Okay. Can you grab my fingers? And that is to test for her motor response. And that's looking good. So now I'm going to hand sanitize. Alcohol swab my reflex hammer. And so testing for her bicep reflex. I'm going to put my thumb in her antecubital area. Test that. Other side. And then I'm going to come right here to brachioradialis using this side of the reflex hammer. Back here to her triceps. Okay, and then I'm going to do a patellar reflex. So you're going to sit at the edge of the chair, dangle your legs for me. And have you had any recent knee injuries or surgeries? Nope. Okay, so that means I can go ahead and do this. Test her reflexes. And then I'm all done with that. So hand hygiene again. And I'm going to grab my stethoscope. Clean this off with an alcohol swab. I'm going to use the bell of my stethoscope to listen to her carotid arteries. So please turn your neck for me. And I'm placing this right in between the trachea and SCM muscle. Other side. Hold your breath. Okay. I'm going to palpate carotid arteries as well. Okay. Now I'm going to switch over to my diaphragm and listen to her heart sounds. So her aortic, which is the right second midclavicular intercostal space. And S2 is louder at that location. Moving over to pulmonic. S2 is louder. And that is the second left intercostal midclavicular space. And then down to her herbs, which is the third midclavicular intercostal space. S1 is equal to S2. Going down to tricuspid. S1 is louder, and mitral, which is the fifth intercostal space, midclavicular, left midclavicular. This one, S1 is louder, and I'm actually going to leave that there. Listen for 60 seconds to get a heart rate, and her heart rate is 69. Okay, now I'm going to go ahead and listen to her breath sounds. There's 6 landmarks on her anterior surface. So 1, 2, 3, 4, 5, 6. Okay, now to listen to her right middle lobe, lift your arm up, please. Mid-axillary, fourth intercostal space. Okay, now to listen to her posterior lung sounds. There's 8 landmarks. 1, 2, 3, 4. Staying away from her scapula. 5, 6, 7, 8. So at the lower rib cage. And I'm just gonna stop here and put my hands at her lower rib cage and ask her to breathe in, breathe out. This is for respiratory expansion. I'm also looking for symmetry. Okay, so now I'm gonna lay her down and I'm gonna inspect her abdomen. So there's no scars, lesions, or bruising. I'm gonna come down at eye level, no pulsations, and flat contour. Now I'm gonna listen to her bowel sounds, and this is 15 seconds in each quadrant, starting at the right lower quadrant, using the diaphragm and going clockwise. So 15, right upper 15, left upper 15, left lower 15. Okay, so 20 gurgles per minute in all 4 quadrants. And now I'm going to go ahead and percuss. Right lower, right upper, left lower. Now I'm going to palpate using 2 finger pads in a circular motion. Do you feel any pain or tenderness? Any pain or tenderness? Okay, so that would be it for the abdomen. So I'm going to put that away. Hand hygiene. and move down to her legs. So testing range of motion, I'm gonna have you bend at your knees, bend at your hips, bend at your knees, bend at your hips. Perfect. Do you have any pain or tenderness? Nope. And another skin inspection. Her skin tone is tan with a pink tone. No scars, lesions, or bruising. So I'm going to feel for warmth. And for edema, I get down to her toes. Cap refill. Less than 3 seconds. Less than 3 seconds. And then I'm going to feel behind her knees right here for a popliteal pulse, feeling for symmetry. Okay, and then same thing for the dorsalis pedis. Perfect. Now for her motor response, can you push down on my hands and push up on my hands? Perfect. And then one more test for range of motion. I'm going to have you wiggle your ankles. Okay, that's good. I'm also going to inspect the bottoms of her legs, no scars, bruising, lesions, also the bottoms of her feet. Okay. And then after that, I'm going to have her sit back up. Hand hygiene. And now I'm going to perform the smell test. So I'm going to have you close your eyes and close one nostril. Tell me what you smell. Okay. Close your other nostril. Keep your eyes closed. Tell me what you smell. Okay. And then after that, I'm going to have her stand up, and to test her balance, we're going to do the Romberg's test. Her feet are together, hands at her sides, and I'm just going to count for 20 seconds with my hand here just in case she falls, and I'm watching for any swaying or imbalances. And then after 20 seconds, I'm going to have you walk 3 to 5 steps forward and go heel to toe back. Okay, and then can I have you put your heel up against your shin like this? Other side, perfect. And then I'm going to have you go like this on your lap. Good. Okay. And then she can sit back down. And I'm going to do a whisper test. So close your eyes. Close one ear and tell me what you hear. And then close your other ear. Tell me what you hear. And I am standing 2 feet behind her. And then I'm going to come back over here, hand hygiene, and that would be it.